The CPT is a performance-based assessment that offers both clinical utility and ecological validity for predicting the relationship of performance to levels of competency required in everyday tasks. Although it uses common daily tasks, it is important to recognize that the CPT is not a traditional IADL or ADL assessment, but is rather a cognitive functional measure that identifies patterns of occupational performance. The specific tasks that are included in the assessment are less important than the manner in which clients respond to the task demands of varying complexity. The CPT looks at the client's ability to sort daily medications, shop for clothing, wash hands, prepare food, use the telephone, travel, and to get dressed. Included with the CPT are 2 medication boxes, medication pills, belts, gloves, utensils, a butter dish, and a box with bathroom items. CH is a 58-year-old female who has recently been diagnosed with Alzheimer's. She has been referred to occupational therapy due to family concerns. Today, the occupational therapist will conduct the CPT to assess CH's cognition with daily tasks in her home. We will now begin the MedBox subtest with CH. Pictured here is the setup of the MedBox subtest. Well, hello. Today we're going to be doing a test to see how you do with your new medications. Here are 4 new medications, and here are the pill boxes. So I want you to set up 1 week of medications for me and follow the directions on the bottles, each one of them. And start with this one.
Okay, so I read what's on there.
Yes, ma'am. Just follow the directions on the bottles.
This is morning. There's not enough.
Just follow whatever directions are on the bottle. check the Arthurix bottle and correct what you did for me?
I have a lot of pain.
Okay. Check the Arthurix bottle and tell me what as needed means.
As needed means when I need it and I need it.
Okay.
1, 2, 3. I need it. All those. I need more.
Would you use a box for scheduled medicine?
And then I use a box for scheduled. What do you mean?
All the other boxes are scheduled. All the other pills are scheduled. And would you use a box for them?
For these or for the scheduled medicine?
For the scheduled. You use the box for that one? For all the other ones?
Mm-hmm.
Okay.
So,
Can you check the Benefa bottle and correct the time of day?
2 pills every other morning. This is morning. Should I correct it? And I think I messed up.
Okay, can you check the Flomaxin bottle and correct the number of pills?
That looks good.
Okay, well we're going to end our test here.
Okay.
Pictured here are CH's completed medication boxes. Shown here is CH's CPT score. We gave her a score of 4.5 because she was able to follow the directions. She got fluidia right, and she only made errors with 2 of the bottles, which were Arthurix and Benefa. Here are the directions for the next task. Listen carefully. I want you to clean your hand after you have been working outside in the yard. Take what you need from this box and use whatever you need in this room. I want you to wash your hand. The soap is in this box. The sink is over there. The sink is behind you, over there. We scored CH a 4.0 due to the fact that she was able to take the soap, go to the sink, turn the water on, wet her hands, use the soap, rinse her hands, dry her hands, and needed no more than 2 directives to get to the sink. The next subtest performed is the toast subtest. Shown here is the setup, which includes a toaster with the cord wrapped around and the plug placed in front of it, 1 loaf of bread, butter in a covered butter dish, 1 jar of jam, 1 jar of mustard, 1 small plate, silverware tray containing 1 butter knife, a small whisk or spatula, a potato peeler, a spoon, and a set of joined measuring spoons. Okay, so this next test has to do with preparing food. So make 1 slice of toast, then put some butter and jam on it. The supplies are on this table. The outlet is over there. So I want you to make 1 slice of toast for me. Then I want you to put some butter and jam on it. Remember, all your supplies are located on the table. Remember to put the butter and the jam on the toast. We gave CH a score of 4.0 for the toast subtest because she put the bread in the toaster, pushed the toaster lever down, waited for it to pop up, and then put the butter and jam on it with the knife. But she also needed help having the work area set up because she did not locate the outlet. She also needed repeat initial directions after setup of the toaster, and she needed verbal cues to continue with the task after the toast popped up.
CH scored an overall of 4.2. This means she had moderate to functional decline. She relies on familiar routines and environment and uses what they see for cues as to what to do. ADLs are remembered, but typically the quality showed decline, such as during the watch subtest, CH could not find the sink. She had a hard time performing tasks with multiple task details and contextual direction without task reduction and cues, just as forgetting to plug in the toaster outlet and not knowing what to do with the toast after it popped up in the toaster during the toast subtest. IADL need to be completed by or with other people. It is not safe for CH to live at home alone.